Uh, Third categories are those patients who have a high bleeding risk. So in that patient, we have to just give DAPT up to 1 month. Then we shift the antithrombotic therapy to the aspirin albuterol just alone for life. Some glimpse from the ischemic cardiomyopathy. Those patients with heart failure with the LVF less than 35%, and we suspect that LV dysfunction is because of coronary disease. Invasive coronary angiography is recommended and viewed towards the prognosis by the cabbage. That's the class 1 recommendation. In heart failure patient with the LVF more than 35% and suspected coronary syndrome, and they were categorized in the low to moderate pretest probability of coronary disease, we can advise them CCT or functional imaging test. And in the patient who have chronic coronary syndrome with heart failure, these patients are enrolled in a multidisciplinary heart failure management. And last one is a class 1 recommendation, sacubitril valsartan preferred over the S inhibitor or ARBs. Okay, how we improve the long-term adherence and to decrease the risk factor, to decrease the risk factor. Yeah, I can tell that. Okay, we have to support the patient in every aspect in a multidisciplinary behavioral prevention. We have to be help the patient to combine with the to be on a drug treatment. Like we have to improve the compliance of patients' drug treatment. We give the fixed dose combination pills and simplify the medical regime. And we have to be in touch with our patients and their feedbacks and prompts. And we provide the telehealth, mental health to the patient that ultimately lead to the good communication, ultimately good communication, structured tools, and visual imaging. So how we will reduce the cardiovascular risk by the healthy lifestyle. What's the healthy lifestyle? That's a healthy diet, exercise, achieve a normal weight, leave smoking, control cholesterol and blood pressure, handle alcohol consumption, and yield to stress management. So we have a healthy lifestyle with that healthy pattern. So there are 5 dimensions for the patients to adhere to the therapy. We first is the disease. We have to beware of disease pattern, how adherence for predictors, considering a graded therapy in multi-formity, and prevent frequent change in the therapy. We have to provide correct, timely, and sufficient information to the patient, improve communication skills, optimize patient perception of risk, and prevent clinical inertia. Provide additional psychosocial support in distress and anxiety, optimize health literacy, empower the patient, increase the patient's self-efficacy. Preferred polypills, increase use of telehealth, consider complexity and workload for patient, and main access to care, easy, rapid, efficient, and affordable. Implement community-based programs, encourage social media coverage to assess therapeutic adherence, and involve informal caregivers that ultimately improve our health outcomes. So how we will follow the patient? How will we follow the patient? We have to assess the symptom severity and frequency. We have to follow the new pattern of ECG changes of the patient, or increase in the severity of coronary disease, and we have to see any new onset of LV dysfunction, and consider the other variables like age, gender, prior ACS, PCR, cabbage, risk factors for the coronary disease, comorbidities, and treatment compliance and lifestyle, genetic predispositions, inflammatory markers, and psychosocial supports, and more frequent follow-up and new diagnostic and therapeutic actions needed. So, what key points for the better care of patient? What key points we have to remember? First, patient-centered care. There, that will be shared decision, shared communication between the patients and doctor. Lifestyle modification, risk factor assessment, and now is a preferred diagnostic tool for the patient who are categorized to the low to intermediate. CCTA is a preferred diagnostic tool and adherence to the medical therapy. Thank you.
Thank you so much, sir, for that insightful presentation. Now it's time for our panel discussion and question answer session. Sir, please ask the question and explore the key points in more depth. So if anyone has any question, can ask.
May I ask a question? Then later on, I will give you my comment on his presentation. I
Yes,
have a
madam.
question for him. Like if a patient, a chronic coronary coronary syndrome patient, already a diagnosed case of chronic coronary syndrome patient, in case if he gets a test done by chance, just he is asymptomatic at the moment, but he get the chance to get a test like physiological test some sort, and what if it comes out to be positive, what to do with him? Chronic
Thank you, madam.
coronary.
Am I audible, madam? Thank you, madam, for your question. The patient, I have shown a slide previously with the asymptomatic patient, and we suggest them any investigation according to his PTS probability. And if they turn out to be in a high risk pattern, then we can go for invasive coronary. If they turn out to be a very high, otherwise, if they fall into low or intermediate, then we just first keep them on medical therapy.
But he is asymptomatic by chance. You have to look at the test report. What is the risk category
Yes,
of
ma'am.
that
Yes,
test?
yes,
On
ma'am.
that,
Yes,
you
ma'am.
will have to.
If
You have
yes,
to.
ma'am.
And you,
Yes,
and
if he
then
fall in the
I think it's important because let's not forget if many diabetics will not have symptoms, whatever is the level of their disease. So
yes, sir. Right.
that is why I think you did show the slide about stress testing
Yes, sir.
and physiological testing. And if it turns
Yes,
out
sir.
to be high risk, at least
I
on
yes, sir.
perfusion scan, more than
Right,
10%
sir.
myocardium is jeopardized, then obviously
Right, sir.
they need it. And of course, if you can assess it even on simple stress testing also, if it's positive at lower level and very clearly positive, more than 2 millimeter of down ST
Right, sir.
depressions, then I think, I mean, more than 2 is definitely high risk. So I think that's how we can assess these patients really. Because many of them may remain diabetic, even non-diabetic may be asymptomatic. So I think that there was a slide I remember which explained all this. The symptoms are important, but even asymptomatics cannot be spared. But let's not forget, the 30% people will lose their life before reaching the hospital in acute coronary syndrome. So it's important to evaluate all of them.
If anyone has any question,
That's meaning.
so
may I give a comment?
Yes, ma'am. Sure, madam.
I think it was a very good presentation. It was a very detailed task you were given, and you got it done just in 1 hour. It was a lengthy topic actually. ये क्रॉनिक कोरोनरी सिंड्रोम जो है ये बहुत लंबा टॉपिक था. इट्स नॉट लाइक यूं क्या कर लिया. आपको बहुत डिफिकल्ट टॉपिक दिया गया हुआ था. इसको आप ले